The day before, of course, over the 24-hour period, we had a remarkable number of only 39 new cases. In the last 24 hours, we've seen a very modest increase to 49 cases, so 49 new cases. Just remind everybody that that still reflects a great effort by our community. Back on the 24th of March, we had got up to 211, and on the 30th of March, my recollection is it was about 212. So I want to thank the community for doing what you're doing, because the efforts that you're making are actually keeping us all safe. The test numbers, I also want to thank our health colleagues, pathology and doctors across the state. The day before we had 3,906 tests done, but that was up in the last 24 hours to 8 p.m. to 4,444 tests. So that's fantastic. Of the 2,822 confirmed cases now across New South Wales, 211 cases are currently in our New South Wales hospitals. Of those 211 cases, I can confirm to you that 29 of those people are in intensive care units. We've talked a lot about ventilation, and obviously once you have to be ventilated, it's a much more serious level of your presence in the intensive care unit. Of the 29 people in the ICUs in our hospitals, 23 are ventilated. One is on ECMO. ECMO, of course, is a higher level of need for the patient. Extracorporeal membrane oxygenation, effectively making sure your organs are being oxygenated. To date, up to 8 p.m. last night, there were 22 deaths in New South Wales. This number of deaths includes one gentleman, a 69-year-old gentleman, who passed away, sadly, at John Hunter Hospital. And again, not just numbers, these are people whose families would be missing them today. And I just want to say, on behalf of all of the community of New South Wales and on behalf of the government and all involved, our sincerest sympathies are with your family. It won't be an easy time for the family of that 69-year-old, as it hasn't been with the previous 21 people. Just reminding you, at 8 p.m. last night, there are 6,103 cases confirmed across Australia. I'll ask Dr. Chant in a minute to make any additional comments that she wishes to make. Just some other matters. Yesterday, I signed an order, but there was also a regulation in concert with that made it very clear that the New South Wales government, and I believe the New South Wales community, will not put up with spitting or coughing on our frontline health workers, whether it's cleaners, doctors, nurses, whatever it be. You're going to cop a $5,000 fine, and I'll ask Deputy Commissioner Warboys to comment on that in a moment. It includes Border Force officers who are working so closely with us. It is absolutely disgusting that anybody could think it's okay to cough or spit on a health worker or any of the other workers. So it's $5,000. Easter, a reminder, don't travel. And parking, today it's free for all health workers. Sorry about that, my asthma's playing up again. I'll just ask Dr. Chan to say a few words.
Thank you. I'd just like to echo the appreciation that the Minister indicated in thanking the community for coming forward to testing. It's been pleasing to see that we've continue to see an increase in testing numbers. And my message to the community is to please, our services are open over the Easter period, and I would urge you to continue to access those services. I'd also like to message to the community that our services are safe and available, so it's very important that you don't neglect any other underlying chronic diseases, or if you develop symptoms that you need to access urgent care, please continue to do so. Thank you. Commissioner.
Thank you, Dr. Chant. Here we are at the start of Easter. right around this state, police are reporting that there's a good deal of consideration and compliance with those requests around not travelling, social distancing, but it's also disappointing in the same time to say that in the last 24 hours, nearly 50 people have been issued infringement notices for $1,000, those people who just failed to get the severity of the situation that we face ourselves in these last few months and days. And of course, these people need to be sent a very clear message that it won't be tolerated. It won't be tolerated by the police or the community. And if you choose to go against what most people in the community think is a reasonable consideration with the situation that we're faced with COVID-19, police will take action. I also know that police have been very considerate in lots of other aspects of their duties, providing information to people and warning people about their behaviour and consequences. And this has also gone a long way towards seeing people return home or, in fact, just simply making that travel in their local area a very short space of time and getting back home where they should be. The Minister also alluded to the fact that from today, police will be able to issue a $5,000 fine, $5,000 for spitting, coughing on an emergency service worker or someone going about their duties in a hospital or a pharmacy. This is a substantial fine. It's something that the police can write on the spot and hand to a person, and it should be something that is not taken lightly. And I have no doubt that that over the coming days we will have to issue some of these fines. If you had have said some time ago when this crisis started that people would go out and cough and spit on emergency service workers and people working in pharmacies and hospitals, I would have thought that was remote. But we already have seen this sort of activity and this action taken by the government, and the fact that today police can write those $5,000 fines should send a very clear message that we're taking this very seriously. I must say that right across country New South Wales and indeed in and around the urban area here, police have been vigilant around people towing caravans, people with trailers and quad bikes and camping gear, people with surfboards, in and around the border towns where it's quite easy to see Queensland vehicles, Victorian vehicles moving into the state for holiday activities. The police have already been significant in terms of their interaction with these people and making sure that where it's appropriate that they go back home where they need to be. With that, I will hand over to Jeremy.
Thank you, and thanks for the ability to be here today. I want to reinforce what the Minister and the police have said in relation to the spitting. Health workers, whether you're a doctor, you're a nurse, you're a cleaner, you're a pathologist, a security officer, they've got their own anxieties at the moment, and yesterday a paramedic raised it very clearly with us. He said, we're working incredibly hard at the moment to keep everybody safe. We're watching our colleagues overseas die. That's what they're thinking about, and the fact of the matter is they want to make everybody safe. So if anybody out there thinks it's funny, thinks it's of some kind of rite of passage to either spit at a health worker or cough on them to make them feel vulnerable, you're a coward, and that's all you are. This society, New South Wales, won't tolerate it, the union movement won't tolerate it, and we will work with the government, as we have been over the past 2 or 3 months, to get things right. That announcement yesterday was one of the best announcements we've seen for a long time. This government is working very hard, and we're going to work hand in glove with them to make sure the people in New South Wales are safe. Thanks.
Thanks very much, Jared. So it's a very clear message to the community that we're all working together. As you can see, the Health Services Union is very supportive of efforts the government's made, but I'm very supportive of the Health Services Union and their efforts to talk to councils right across the state, to ask councils to come on board and support the efforts that the state government's made. The announcement today about free parking for all of our health workers in our car parks is just part of the equation. We're certainly very supportive of the Health Services Union's efforts to reach out to councils across the state to ask them to, during this crisis, make special arrangements around hospital areas. It obviously can be worked through locally with councils as to how they might do that, but at the end of the day, health workers are the very best friends that we could ever have during this crisis. So hopefully councils will find ways to ensure that health workers, the people that will look after us if and when we're subject to this terrible virus, will have free parking so they can do their work without having to fear or worry about the consequences of where their vehicle is. Now, sorry, Chris, happy to take questions, and you can address questions to any one of the folks who are here today. Chris. If I had my choice, I would be locking them up pretty quick smart, but the police will hand them in the first instance a $5,000 fine. There is another option, and that is that if the police choose to, they can actually enforce a court attendance notice and a charge, which would allow an $11,000 fine and $6,000. But this is a on-the-spot $5,000 fine. I can't remember any fine like this in the past history where a police officer could hand over a $5,000 fine on the spot. It's quite unprecedented, but I think it reflects the community disgust. You've heard from Gerard Hayes on behalf of the health workers. You've heard Deputy Commissioner on behalf of police. Of course, it is absolutely disgusting to think that anybody would think it's okay to cough or spit on a police officer or a health worker at any time, let alone in the world's worst virus crisis for 100 years. So $5,000, you should be very lucky you're getting off lightly. I'm sorry, Chris. I haven't been to McDonald's for a little while. I may look like I have, but I haven't been. So what are you saying?
What I'm saying is to be extended beyond police and health workers.
Oh, look, can I say, I think it's fair to say, since the first 4 people sadly became victims of this virus back at the middle to the end of January, it's been an evolution for all of us, and for the community, but also the government. We have tried to step up at every occasion, and the Premier of New South Wales has led us like no leader could possibly be expected to do. She's been working 24 hours a day, generally anyway. You can ring her any time and she's on the phone. This will be an issue that we will look at. If there are other activities that people do or think are unacceptable, we will look at it. We'll work with our police and our frontline health workers, and there may well be other steps, but today, quite simply, a $5,000 fine is a very substantial message.
On the NRL, Coach Wayne Pearce yesterday said that the NRL had permission to train and play. Was that permission?
Look, I did hear that. The NRL came to see me about a month or 5 weeks ago, and there have been no further discussions, so I can't really comment on that at this stage.
The government hasn't provided.
I haven't, but I can't comment. I just can say.
Do you agree with the game running?
If the NRL want to go ahead, happy to have the chat and make sure with medical advice as to whether or not it's appropriate. Sorry.
Really,
Chris.
what level of involvement has there been from government or health with this NRL process?
The only meeting I've had that I can tell you about is around about a month ago with Todd Greenberg and Peter Vlandis to talk about the issue, but that was before they actually made a decision to shut the game down. So I haven't had any discussions with them at this stage.
Are you surprised? I mean, is it completely out of step?
No, I mean, look, I think that there's a balance to be struck here, and whether this is the right balance, I'm happy to talk to the NRL, because as Health Minister I also know that we need to have a sense of balance about our life, a sense of mental health, and I know a lot of people enjoy seeing sport, so we can have that conversation with them. I'm not giving any indication one way or the other. As long as there's health advice that it would be acceptable, and if there's not health advice, well, at this stage I can't comment. I'm not commenting any further on that issue. No, actually, I think that, first of all, I haven't actually given a message on that at this stage. I've said that I'm happy to have the discussion. But to the community, I would certainly say, and I'm sure Dr. Chant would say, please exercise. Please get out and exercise, because if you want to build your immune system, and we want people to build their immune... Sorry, if we want people to build their immune system in terms of exercise, the broader question you asked me, yes, get out and do some exercise, because there's nothing like being healthy and having a good immune system to fend off this particular virus. Sorry, you're going to ask me a question. Sorry, Chris, I'll come back to you.
Why should Don Harwood not be sacked now that he's been fined and breaching COVID restrictions?
Look, as I said yesterday in relation to Mr Harwin, it doesn't matter who you are. There are very strict rules to try and keep us all safe. And the imposition of a fine, if that's what the police consider appropriate, is a matter for them. I can't comment beyond that. That's not my purview. I'm the health minister to look after people who are trying to keep them healthy. That's my purview.
Does it concern you that the Premier Admiral said that it's technically not breaching rules, but it was?
As I said, my job as the New South Wales Health Minister is to look after the health of the people of New South Wales, and I don't see that it's appropriate for me to be commenting on other matters.